Hello, my name's Gemma and I'm a hand physiotherapist at North Bristol NHS Trust. This is a short video for patients who have been treated for a finger mallet injury. I'll explain how your splint works, why it's so important to wear it correctly, and how to safely take care of your finger whilst it heals. A mallet injury happens when the tendon that straightens the tip of your finger is damaged, often from a knock or a sudden force. To allow this tendon to heal, we use a small splint that holds the finger straight. It's really important to keep the fingertip completely straight at all times, 24 hours a day, 7 days a week, for at least 6 to 8 weeks as guided by your physiotherapist or doctor. Even a moment with the fingertip bending can delay healing and set back your progress. You'll need to keep your finger clean, and you can remove the splint approximately twice a week for basic hygiene. But be very careful. Here's how to do it safely without bending the tip of your finger. With your hand rested flat on the table, palm facing down, carefully slide the splint off the finger, keeping the fingertip supported on the table. It is useful to ask a family member or friend to help. The finger can be washed on the top, carefully supported and washed underneath, and placed back down on the table. The splint can then be slid along the finger, keeping the fingertip completely straight at all times. Once in the splint, you can turn the hand over and apply 2 small pieces of tape. Tape should not go over the middle joint of the finger so that the finger is still free to bend and straighten. If you have a custom-made splint, it's very similar. Slide the splint off, keeping the finger supported on the table. Wash the top, support the finger, lift it and wash the bottom. The splint can then be reapplied. Using 5 or 6 small pieces of tape, apply a downward pressure and then pull the tape around the sides of the splint. Once you have one piece of tape on, you can then use a few others, overlapping by a half, to keep the finger well supported in the splint. Again, the middle joint of the finger should be left free to mobilise and straighten. Ensure the splint is snug and not too tight. Never let the finger droop. Wear the splint at all times. Watch out for any redness, soreness or swelling, and contact the hand centre if any issues arise. With careful use of your splint and a little patience, most mallet injuries heal very well without surgery. If you follow these steps and have any concerns, our team is here to help. Thanks for watching and take care.